A psychiatrist is first a medical doctor, so they treat medical conditions. Just like other specialties in medicine, the medical conditions they focus on, however, have to do with the brain and the behaviors and illnesses or conditions that are related to when things go wrong or not working as well in the brain. In general, for all of those conditions, they are in general the same rate in the African American community as the whole community of the U.S. population, which is where we tend to get our statistics. African Americans, even though we might have the same kind of prevalence or occurrence of mental disorders, actually suffer a greater amount of disability. So that means that by the time we get to treatment, by the time we're admitting there's a problem or actually have the ability to access the care, we're sicker when we get to that doorstep. In general, healthcare in African Americans also incorporated experimentation and very unethical practices from a long time ago. So that history has, kind of continued in the minds of a lot of African Americans, even if not in practice, but in the minds. The unethical practices and experimentation does not happen any longer for any community in healthcare. There's kind of the stigma that going and getting help from a mental health care professional means that you're crazy. And that's what people tend to say to me. Once they get to me, it's like, I didn't come for so long, I didn't want someone to think I was crazy. So there's that kind of fear that this means that something's wrong with me personally, and there's not the very good understanding that this is a medical condition and not a personal weakness. Even today, in all honesty, there are not enough African American mental health care professionals, so it really does usually mean going outside of your community and telling someone your personal weaknesses at your most extreme vulnerable time. So the most common actually under the mental illness category are the anxiety disorders. And there's all sorts of different kinds of anxiety disorders, and if you think about it, everyone experiences anxiety, nervousness to some degree, but we're talking about the disorders where that level of nervousness or anxiety impairs someone's life either on a daily basis or to the point where they can't function. So having a full-blown panic attack, for example, really feels like terror and fear coming from nowhere and out of proportion to the situation. We like to see people sooner rather than later because these symptoms left untreated can kind of have a snowball effect and make it more difficult to treat. And a lot of the different diagnoses will kind of have cutoff periods for how long, these things can occur before it's identified as an illness. Because people do have days when they're not feeling well or kind of down and depressed. But the illness, the clinical illness, is a different situation where it occurs for weeks. Where does one go for treatment? I always say start with your family doctor, your primary care doctor, for a couple reasons. One, it's usually the person you're a little more comfortable with. Everyone should have an identified family or primary care doctor. And also that person can begin to look at other things that may mimic or look like it's potentially a mental illness. And frequently that person has connections or access to a mental health care professional that may not be available to an individual person seeking that out. In general, it's more like probably a long history taking that's similar to the family doctor. So the very first time someone goes to any doctor, they're asking a lot about their functioning, their past history, any symptoms they have that may be causing them distress or pain. That's not much different from the psychiatrist's first visit. Treatments vary depending on the condition itself, but they kind of are broken down into two big groups. One is the counseling. Some people call it psychotherapy, counseling, or talk therapy. And it really isn't mysterious or mystical. It's actually sitting down with someone to identify a lot of things. Sometimes it's the current stress in your life. Sometimes you get some guidance on what to do to address that stress, or look at other lifestyle behaviors that would either help you function or things that are getting in the way of functioning. So all of that is kind of under the counseling piece. And then the other side is the medicine side, or medications to treat mental illness. And there are specific medications, there's a whole variety of them, and they need to be matched with the person and the condition.